You probably already know that a bad night's sleep makes you foggy the next morning. That's obvious. But what if I told you that those restless nights aren't just stealing your focus? They might be slowly stealing your future. Over the last decade, scientists have discovered something remarkable about what happens inside your brain while you sleep. It turns out that sleep isn't rest, it's maintenance. And when that maintenance doesn't happen, night after night, year after year, the consequences go far beyond feeling tired. This is the story of how sleep and dementia are connected, why your brain needs those 7 to 8 hours more than you think, and what you can start doing tonight to protect yourself. Let's start with a discovery that changed everything neuroscientists thought they knew about the brain. For over a century, researchers were puzzled by a basic question: how does the brain take out its trash? Every organ in your body produces metabolic waste, byproducts of normal cell activity, and every organ has the lymphatic system to clean that waste up. Every organ except the brain. The brain is the most metabolically active organ you have. It burns through enormous amounts of energy, but it didn't seem to have a drainage system. The waste just disappeared. Nobody could figure out where it went. Then, in 2012, a team at the University of Rochester discovered the answer. They called it the glymphatic system, a network of channels that runs along the blood vessels in your brain, powered by specialized cells called astrocytes. Here's how it works. While you sleep, cerebrospinal fluid, the clear liquid that surrounds your brain, gets pumped through these channels and into the spaces between your brain cells. It flows through the tissue like a slow-motion pressure wash, picking up waste proteins and flushing them out. And not just any waste proteins. The two proteins it clears most aggressively are beta amyloid and tau, the exact proteins that build up into the plaques and tangles that define Alzheimer's disease. But here's the critical part. This system is almost entirely dependent on sleep, specifically deep sleep, also called slow-wave sleep. During deep sleep, the spaces between your brain cells expand by as much as 60%. That expansion reduces resistance and allows the cleaning fluid to flow freely. The result? Your brain's waste clearance rate during deep sleep is roughly 10 times higher than when you're awake. When you don't get enough deep sleep, that cleaning cycle gets cut short. The waste doesn't get flushed, it stays, and over time it accumulates. Think of it like skipping the dishwasher. One night, no big deal. A week, things start to pile up. A decade, you've got a serious problem. So the brain cleans itself during sleep. But how much does sleep duration actually affect your risk of dementia? For that, we turn to two of the largest and longest-running health studies ever conducted. The first is the Whitehall 2 study, which followed nearly 8,000 British civil servants for over 25 years. Researchers tracked their sleep habits starting in midlife, when participants were in their 50s and 60s, and then monitored who developed dementia decades later. The findings were striking. People who consistently slept 6 hours or less per night at age 50 had a 20 to 40% higher risk of developing dementia compared to those who slept 7 hours. And if that pattern of short sleep continued through their 50s, 60s, and 70s, the risk increased by 30%, even after accounting for other health factors like heart disease, diabetes, and depression. What makes this study so important is the timing. These sleep patterns were recorded decades before any dementia symptoms appeared. That means short sleep wasn't a symptom of early disease. It was a risk factor in its own right. The second study, the Framingham Heart Study, looked at the other end of the spectrum, people sleeping too much. Among older participants, those who regularly slept more than 9 hours per night had double the risk of developing dementia within 10 years. And people whose sleep duration increased over time, going from normal to 9+ hours, had nearly 2.5 times the risk of Alzheimer's. Now, researchers don't think long sleep causes dementia. Instead, they believe it's a warning sign, a signal that the brain is already struggling. Brain scans of these long sleepers often showed smaller brain volumes and reduced executive function. So what does this tell us? In midlife, too little sleep is a genuine risk factor. In later life, too much sleep may be a red flag, and across the board, 7 to 8 hours appears to be the sweet spot. Now, there's one sleep condition that deserves its own conversation, because it combines almost every risk factor we've talked about into a single diagnosis. It's called obstructive sleep apnea, and if you snore heavily, wake up gasping, or feel exhausted no matter how long you sleep, you need to pay attention to this. Sleep apnea happens when the muscles in your throat relax during sleep, and temporarily block your airway. Your brain notices the drop in oxygen and jolts you awake, sometimes dozens or even hundreds of times per night. You may not remember these awakenings, but your brain does. The damage from sleep apnea is a triple threat. First, every time your oxygen drops and comes back, it creates a burst of oxidative stress, the same kind of cellular damage linked to aging and inflammation. Over time, this activates the brain's immune cells in a way that becomes toxic to neurons, especially in the hippocampus, the region most critical for memory. Second, those constant micro-awakenings prevent you from ever reaching deep sleep. If you can't get into slow-wave sleep, the glymphatic system can't do its job. The waste proteins build up. Third, the physical effort of breathing against a closed airway creates pressure changes inside your skull that can actually impede the flow of cleaning fluid through the brain. The good news? Sleep apnea is treatable. CPAP therapy, that's the machine that gently keeps your airway open while you sleep, has been shown in clinical trials to slow cognitive decline in patients who already have mild cognitive impairment. It can reduce the buildup of amyloid proteins in the blood and improve memory scores. 12 months of consistent CPAP use made a measurable difference. If you've been told you snore, if your partner says you stop breathing at night, or if you wake up feeling like you didn't sleep at all, talk to your doctor about a sleep study. This is one of the most actionable things in this entire video. Now let's address something I hear all the time. I'm older now, I just don't need as much sleep as I used to. This is one of the most common and most dangerous misconceptions about aging. Here's what's actually happening. As the brain ages, several things change. The suprachiasmatic nucleus, your brain's internal clock, loses neurons over time. This weakens your circadian rhythm, making you feel sleepy earlier in the evening and causing you to wake up earlier in the morning. Your body also produces less melatonin, the hormone that signals it's time to sleep. And the internal pressure that builds up the longer you're awake, the thing that makes you feel genuinely sleepy, becomes less efficient. On top of all that, the amount of time you spend in deep sleep drops significantly. Younger adults spend about 20% of their night in deep, slow-wave sleep. By the time you're in your 60s or 70s, that can drop to 10 or 15%. And since deep sleep is when the glymphatic system is most active, this reduction means your brain has less time to clear waste, even when you're sleeping a full night. So the ability to sleep changes, but the need doesn't. The CDC and the National Institute on Aging both recommend that adults over 65 get 7 to 8 hours of sleep per night. The problem is that many people accept poor sleep as a normal part of aging. They don't mention it to their doctors, they don't seek help, and that's a missed opportunity because there are real things you can do to improve your sleep quality, starting tonight. Here are the strategies that sleep researchers and geriatric specialists recommend most. None of these require a prescription. All of them are backed by evidence. First, and this is the single most important one, go to bed and wake up at the same time every day, including weekends. Your circadian rhythm thrives on consistency. Every time you shift your schedule, your internal clock has to recalibrate, and that gets harder as the clock ages. Second, engineer your bedroom for sleep. It should be dark, genuinely dark, not just dim. It should be quiet, or use white noise if you need it. And it should be cool, between 60 and 70 degrees. Your body needs to drop its core temperature to initiate sleep, and a warm room works against that. Third, start a wind-down routine 90 minutes before bed. Dim the lights. Avoid upsetting news or intense shows. Read a physical book. Take a warm bath. The drop in body temperature afterward actually helps trigger sleepiness. And put the screens away. Blue light from phones and tablets suppresses melatonin production, and the stimulation keeps your brain in alert mode. Fourth, watch your caffeine and alcohol. Caffeine has a half-life of 5 to 6 hours, and it can linger even longer in older adults. That afternoon coffee at 2 p.m. might still be in your system at 10. As for alcohol, I know, a glass of wine feels like it helps you relax. But alcohol fragments your sleep architecture. It suppresses REM sleep and causes early morning awakenings. It's one of the most deceptive sleep disruptors there is. Fifth, if you can't sleep, get up. This sounds counterintuitive, but lying in bed awake teaches your brain that the bed is a place for frustration, not sleep. If you haven't fallen asleep within 20 minutes, get out of bed, Go to another room, do something quiet and boring, and return only when you feel genuinely sleepy. And sixth, and I cannot stress this enough, if you snore, if you wake up gasping, if you're exhausted despite spending 8 hours in bed, talk to your doctor. A simple sleep study can diagnose sleep apnea, and treatment can make a profound difference, not just for your energy, but for your long-term brain health. Here's what I want you to take away from this. Sleep is not a luxury. It's not something you earn after a productive day. It's not optional. Sleep is when your brain does the maintenance work that keeps it functioning. Without it, waste builds up, inflammation increases, and the proteins that cause Alzheimer's disease accumulate silently for years before you notice a thing. The research is clear. Protecting your sleep in midlife reduces your dementia risk. Treating sleep apnea slows cognitive decline, and maintaining good sleep habits as you age supports the very system your brain depends on to stay healthy. You can't control your genetics, you can't reverse time, but you can protect your sleep. And that might be one of the most powerful things you do for your brain, starting tonight. Stay informed, stay independent, stay sharp.